The UN is asking for billions of dollars to help those most in need during the coronavirus outbreak, including refugees fleeing conflict and violence. But with countries stretched to the limit protecting their own citizens, will the most vulnerable get left behind? This is Roundtable. The spread of coronavirus has been rapid through countries and communities that are wealthy and well-organised. So it's little wonder there's concern that places hit by crisis and conflict will be unable to contain the outbreak, and that could have dire consequences.
As the coronavirus forces the world's biggest cities and wealthiest countries into lockdown, a potential humanitarian catastrophe threatens tens of millions of people crowded into refugee camps and makeshift settlements. From displaced people from Bangladesh to Syria and across Africa, where healthcare and clean water is often scarce, sanitation is poor, illnesses are rife, and social distancing is almost impossible. Settlements like the Moria refugee camp in Lesbos in Greece, designed to house 3,100 people, now have a population of more than 20,000 men, women and children. In northwest Syria, nearly 1 million people fled towards the Turkish border in recent months due to escalated Russian and Syrian regime bombardment. And aid workers are warning that cramped, wretched conditions at the world's largest refugee camp in southeast Bangladesh leaves almost 1 million Rohingya refugees at high risk of contracting the virus. The UNHCR, the UN's refugee agency, is seeking $255 million to lessen the impact of COVID-19 outbreaks, especially in these vulnerable communities, as part of a wider UN appeal seeking $2 billion. But many of these appeals have fallen short before. So what action needs to be taken to mitigate yet another looming humanitarian disaster?
Well, joining us to talk about all this from Paris is Ole Solvange, who's Director of Partnerships and Policy at the Norwegian Refugee Council. In Baltimore in the United States, we have Dr. Paul Spiegel, who's the Director of the Center for Humanitarian Health at the Johns Hopkins University Bloomberg School of Public Health. And then also in the United States, in Washington, we have Erol Yayboke, who's Deputy Director and Senior Fellow with the Project on US Leadership in Development and Project on Prosperity and Development at the Center for Strategic and International Studies. Thank you very much indeed for joining us, gentlemen. So first question, just how bad is the situation for refugees right now? I'm thinking particularly in refugee camps. What's the situation there?
Well, what we in the Norwegian Refugee Council are seeing is that, in some of the places that we're most concerned about, we haven't really had widespread, a widespread of the coronavirus yet in terms of confirmed cases, etc. But we are very concerned about what will happen when we see that the coronavirus hitting those places. And that is because, as you mentioned in your introduction here, very often the places where these refugees or also internally displaced people are located, they're overcrowded, they might have lack of access to washing facilities, sanitation facilities, etc. So we're concerned that once the virus reaches these places, that it will spread very quickly and that it will be difficult because of the very poor health systems that many of these people have access to, won't be able to cope. So we're concerned that this will have a major impact on some of the most vulnerable people.
I think there's also, if I may, an element of, there's not a whole lot of testing in these places. There's probably more testing in camps, although a majority of the forcibly displaced around the world don't live in camps. And so in a lot of these communities that my colleague was talking about, we just don't have an accurate picture of what the scope of the challenge is. Those of us that think about this are also worried that even though there's not a huge outbreak that we know of now, that for reasons that my colleague talked about, those types of communities could be where a second or third wave of coronavirus sneaks up on us, and I think that's pretty scary.
And perhaps I'll just add is that how to try to mitigate in these situations, particularly in refugee or IDP camps where there's so much overcrowding and there's underlying poor health status generally of refugees. It's hard to know at this point how such a COVID outbreak in those situations will react. Right now it's the older population over 60 that are at risk, but in many of these vulnerable populations that have underlying disease burdens, it may be even stronger and may even affect more negatively a younger age group.
And are there any areas which are particularly vulnerable? Paul, I know you've done work on the Rohingya refugees. Are there anywhere in particular that could be facing a disaster if COVID-19 has an outbreak where they are?
Yeah. It's the areas where there are a lot of people congregated together in a very dense environment with poor health settings. So we did look at the Rohingya refugee situation. We did some modeling of low, medium, and high transmission, and we chose that area because you have over 900,000 people congregated in a very, very small environment. But there are many other situations, such as many of the camps, but also, as Erol mentioned, outside of camps where there are more refugees, is also very concerning. One, because they're often sharing apartments, but number two is they're often limited access to health services, and how that may change when an epidemic occurs within that community. How will governments actually will they allow refugees access to the hospitals and the ICUs as they have had in many situations in the past?
I would be worried about the camps, but I also think that in a lot of camps there are fantastic organizations like the Norwegian Refugee Council operational and providing support. I'm worried about those. I'm more worried about informal IDP settlements, so internally displaced persons. Think of between Idlib and northwest Syria and the Turkish border, there's probably 700 to 900,000 internally displaced people that are kind of stuck between a rock and a hard place, and they're not in formal camps. Those people are just kind of camping wherever they can, and they don't, there's humanitarian access challenges for those people. So groups like the NRC can't get in to the degree that they need to. So I'd be worried about informal IDP settlements.
Let's explore these people who are somewhat under the radar, the idea of that. Is the main problem that they aren't getting perhaps the medical treatment that they need, or is the main problem that, say, they do have the virus and they don't know it because they're not being documented, they may be passing it on as they move around? They're not perhaps under lockdown in the same way as somebody in a camp might be.
Well, I think there's both, right? I think what we're worried about is, on the one hand, the spread of the virus, and I think it's interesting to see how all of us are now kind of sitting in lockdown, because we all recognize that is partially an effective measure of spreading the virus. At the same time, we see that people continue to be displaced in many places around the world. And my colleague here on the panel just mentioned Idlib and northern Syria. And this is a place where we, up until very recently, and we continue to see displacement. So I think what's also needed here in terms of preventative measures is also that we all need to think about what is it that is driving displacement in these places and take the action that we can. So, for example, in terms of Idlib, really this is the time for the parties to the war in Idlib to think twice about military offensives, etc., that will drive people, force people away from their homes, and thereby continuing to the spread. So I think part of it is the contributing effect of spreading the virus, but then also it is the health systems and access to basic health care. And just to add, to what was said before here, we're also concerned about the Rohingya in Bangladesh and Syria, another country where, if the virus spreads there, it could have very significant negative consequences would be a country like Yemen, for example, where we know that there aren't that kind of camp structure that we were just talking about, that in some ways is can make spreading of the virus quicker, but where there is some level of response. In Yemen, there are very few camps, and most of the people are in informal IDP settings with very limited access to health. So there's several countries around the world where this could become a major issue.
I wonder then, are we likely to see perhaps a ceasing of hostilities in certain places? I gather that the so-called Islamic State has sent a bulletin to its fighters suggesting it hold off on any offensives right now. Could we see a rollback in hostilities as a byproduct of this?
Maybe I wouldn't call it a rollback, maybe a ceasefire. The ELN, which is after the FARC went away in Colombia, the ELN is the main armed group that's still wreaking havoc across Venezuela and Colombia. And they yesterday issued similar guidance saying, hey guys, let's pause for a little bit. I think it's up to kind of the international community and local leaders to take advantage of maybe this unforeseen opportunity. It's difficult to talk about a pandemic as an opportunity, but from a conflict perspective, perhaps there is a small window.
So what action should be taken? This is obviously a huge question, but is there anything in particular that can be done to help mitigate what could be a potential disaster for refugees?
Well, I think from our side, from the Norwegian Refugee Council, what we're trying to do now is really to make sure that we are as prepared as possible, both in the camp settings that we are, but also in other places. And that is all about, some of the scale up of programming that we're doing right now. We're conducting awareness campaigns among the people that we're trying to serve. We are scaling up and building up facilities so that people have access to water, and enough water so that they can actually wash their hands. They have access to soap, they have access to hygiene kits, etc. But we're also looking at, and this particularly with the camp settings where we're working, we're also looking at making sure that even in these camp settings that there are places, there is space for quarantine, for isolation when people get sick, so you can also limit the spread in the camp itself. So the range of things that we are doing right now that we hope will make these communities less vulnerable and more resilient when this moment comes.
There's a lot of focus here in the U.S., or at least, sorry, Paul, at least on my Twitter feed, there's a lot of focus about frontline health workers and those that work in hospitals and everything, and they are truly heroes. I want to add frontline humanitarian workers to that, because I think what was just described is no easy feat. The thing that I wanted to add, though, is my worry is that as countries, and you started with this in your intro, as countries think about their own problems, my worry is that there will be less of a focus on these international challenges that I think are, the humanitarian community is sort of chronically underfunded. UN appeals scarcely get fully funded. There's a new appeal that's COVID related, that's coronavirus related. I hope it gets funded, but I think that there's going to be a challenge in sort of Western capitals, which are primarily the ones that provide funding for things like this. There's going to be, and we're seeing it already in the United States, a push to focus a little bit more inward, and I think that's wrong and dangerous.
I would definitely agree with that. I'd also like to add two other components. What we are working with at Hopkins with many NGOs in the United Nations is to look at program adaptation. There are a lot of ways that we work in the humanitarian world, such as general food distributions, where you're gathering a lot of people together that obviously can exacerbate the transmission. So how do we start? How we have to examine our current programs and then see how they can be adapted to reduce the transmission or the likelihood of transmission. And there are many other examples of that. There are also maybe some unexpected and negative consequences when people are put together, isolated, unaccompanied minors. There could be an increase in intimate partner violence, physical or gender-based violence amongst unaccompanied minors. So there are a lot of big protection issues that we need to consider as well.
But I think, Erol, you mentioned that the funding might not be there, funding that has previously been, well, it hasn't been full funding, but the amount of money potentially going to help refugees is likely to be reduced as people start to look inward. Is this going to be a real factor in dealing with coronavirus in the refugee population?
First of all, I hope that it doesn't. I hope that I'm wrong. Part of my job is thinking about some of these challenges and thinking about what's coming. And I hope we look back on this and say Erol was really, really wrong about that. And the international community stepped up and funded the NRCs of the world and all of the frontline humanitarian organizations the way that they need. My fear is, though, that there will be this inward push.
Do you think we need to look more globally at this? Look more outwards rather than inwards?
I think
we have to do both. We have to walk and chew gum at the same time.
I think we're already seeing some impact of this, right? So you have kind of, for humanitarian work, there are two main funding streams, if you like. We're financing humanitarian work in two main ways. One is by fundraising, and the other one is from institutional donors, governments, foundations, etc. And where we're already starting to see an almost immediate impact is on the private fundraising side. You have quite a lot of people who are coming and are really seeing this as a joint problem. There's a very strong movement of solidarity. And so, on the one hand, we see that new donors are coming, new private donors are coming, they want to help, and etc. But you also see that people are getting very quickly concerned about their own financial situation. We've all seen the news about, massive unemployment rising very quickly. And it's no wonder in those circumstances that people start thinking about what are the optional expenses that I have that I can cut already at this point. So I think we're going to see that on the private fundraising side, that will be very tightly follow the economic situation and then employment rates, etc. And then you have on the government side, on sort of the institutional donor side, and so far the messages that we're receiving from a lot of our partners is that they are committed to maintaining funding for humanitarian work now in an emergency period, to scale up the response to the coronavirus, etc. But that over the long term, that they're committed to doing that. I really hope so, but I think I share some concerns what the long-term prospects would be, and what the takeaways from politicians and the general public will be from this crisis. Is it, on the one hand, like I would argue that this crisis really shows that we're all in it together, and you cannot close your borders, and no matter how much you close your borders and look, just care about yourself, these things don't stop at the borders, right? And so therefore we are in it together, and we need to show solidarity. And poor health conditions in Yemen could potentially have an impact on us as well. I hope that that's the takeaway, but it could also be that the takeaway is that we need to really focus on ourselves and take care of ourselves. And I think one of the statistics, or one of the facts that really struck me the other day is if you look at the health system, if you look at access to ventilators, which is, for those who get really sick, it is important to use ventilators to be able to breathe. A country like the Central African Republic has 3, the entire country, right? And that just shows the differences here and the disparity, and how the reaction to this crisis, that the capacity to react to this crisis is very, very different from country to country.
And Paul would know better than I on this, but this comes back to an earlier point that I made about these things generally have a second or a third or more wave. And unless we prepare the Central African Republic in some way, unless we partner with them and others around the world in some gesture of international solidarity, like was said, these things don't stop at borders. Unless we do that, we could see future waves that, again, put us all at risk.
even if there was sufficient funding, there are still many issues that would need to be addressed. Number one is capacity. It's not like in an Ebola situation where the international community can start sending in thousands of healthcare workers from around the region and the globe, because of the people are not going to be able to move in the same way because of the pandemic and the restrictions, number one. And then number two, when your ICUs are completely filled and you do not have enough ventilators and respirators, what will happen to refugees? Will the governments make a very difficult decision to say, we're not going to allow refugees access to the hospitals in the same way that we have in the past? And that would be horrific for a variety of reasons. It would certainly increase the number of deaths amongst the refugees. But who is going to then take care of this? I mean, despite all the goodwill of the international community, it's going to be extremely hard to set up field hospitals with ICUs. I just don't see that happening in the midst of this pandemic.
Well, I wanted to ask you about policy, because Portugal has actually announced that full rights will be given to migrants during this outbreak, including access to healthcare. What kind of difference would that make if it was rolled out around the world? Is that the kind of thing you'd like to see?
I think Portugal, I'll just start. Portugal, it's an extraordinary gesture. I think it sadly will be rare for other countries. When you look, for example, in Greece and how Greece is currently treating their migrants and refugees in closed encampments. So I don't see that following everywhere. And it also depends on the burden of refugees that countries may have. And it may be easier for some countries to do that than others. But it would be wonderful if other countries could follow Portugal's example.
I think what we have seen in several countries, and which is a good thing, is that a lot of countries have either suspended or stopped now temporarily efforts to send back refugees or asylum seekers who are being denied asylum, etc. And so that's of course a good thing. But you know, we haven't yet seen the kind of measures that Portugal has taken. Recognizing also that even in Portugal, this is kind of a temporary measure for now, for a period of time. So let's also see how that pans out there. But it's definitely a positive thing. I wanted to just come back to one thing that Paul sort of mentioned in briefing, and this is one of the things that we now on the ground in the field at the Norwegian Refugee Council experience as one of the main challenges right now. And this is, of course, and this is the movement restrictions that we're facing. So you have lots of governments right now who are taking tough and much needed measures to spread to halt the spread of the virus, and that includes lockdowns, and it includes curfews and restrictions on movement. But in many places, we see that this also affects our ability to work unless we get permissions from the government to continue our work. And you know, our sort of plea to governments is that they make sure to allow that critical life-saving assistance to continue, through distribution where that's necessary, WASH programs where that is necessary, can help protect refugee communities. This is also an ongoing conversation that we have with many of the governments where we're operating. You know, what is the critical life-saving assistance that we need to do, and how can they facilitate that so we can continue with that, even as we're all sort of respecting national authorities' guidelines to help to prevent the spread of the virus.
And one thing I'll be watching there, just real quickly, is how much of those restrictions outlast the pandemic. I think we're already seeing leaders with authoritarian tendencies in, say, Hungary and the Philippines taking pretty extreme power for themselves under the guise of this being an emergency. And funnily enough, history shows us that emergencies tend to pop up every once in a while, and those emergency powers tend to have far more durability than the emergency itself. And so I'll be watching, and I think we should all be watching with pretty wary eyes about that.
And I wonder, just lastly, do you think that having faced a crisis like this at home, this will make people more sympathetic to the plight of refugees? They're going through something not similar, but something that's affected their freedom of movement, their way of life. Do you think this will increase sympathy for people, migrant people, people who are displaced?
I think we do see in many of the places that we are a wave of sympathy and a wave of solidarity in a way. And I think it is really important to highlight that. I think we're all concerned about lots of things. We're concerned about the funding. We're concerned about the refugees. We're concerned that there could be a backlash. But at the same time, there is a tremendous sense of solidarity and sympathy that we're experiencing, at least. People are coming to us. They want to help us. They want to donate so that we can help other people. In some of the most vulnerable people who are out there in these situations. So I think that is an important takeaway in a way that it is a tremendous crisis, but it also really, in many places and in many ways, brings out the sort of good of humanity as well.
OK, gentlemen, we will have to leave it there. Many thanks indeed for joining us, Ole Solvange, Dr. Paul Spiegel and Erol Yayboke. Thank you. Remember, you can see more discussion and debate on our YouTube channel. Search for TRT World Roundtable. But for now, from me and all the team here, goodbye and thank you for watching.